Spleen. The spleen is the largest lymphoid organ or hemolymphoid organ situated in the left hypochondrium. Size and shape. It is purple in color and its size corresponds to the fist of the subject. Shape. According to the shape, the spleen is classified into three types. Wedge shape, the most common one, tetrahedral and triangular. Situation. It is located in the left hypochondrium between the fundus of the stomach and the diaphragm, opposite to 9, 10 and 11th ribs. Measurement. It is 1 inch thick, 3 inch broad, 5 inch long and weighs about 7 ounce, approximately 200 grams. External features. The spleen has two ends, anterior end and posterior end, three borders, superior, inferior and intermediate border, and two surfaces, visceral surface and diaphragmatic surface. Ends. There are two ends, anterior end which is broad and directed downwards, forwards and to the left. The posterior end which is blunt and rounded and directed upwards, backwards and medially. Borders. There are three borders, superior border, inferior border and intermediate border. Superior border, inferior border and intermediate border. The superior border is thin, curved and it is characterized by presence of 1 or 2 notches near its anterior end. The superior border separates the gastric impression of the visceral surface from the diaphragmatic surface. Inferior border, it is rounded and it separates the renal impression of the visceral surface from the diaphragmatic surface. Intermediate border, it separates the gastric impression from the renal impression present on the visceral surface. Surfaces. There are two surfaces, visceral surface and diaphragmatic surface. The visceral surface is curved and irregular and presents three impressions: gastric impression, renal impression and colic impression. On the visceral surface, there is a slit or opening known as hilum of spleen. The structures present in the hilum of spleen are splenic artery, splenic vein, sympathetic plexus surrounding the splenic artery. The diaphragmatic surface is smooth and convex and it is related to diaphragm. Relations. The visceral surface presents three impressions: gastric impression, which is related to fundus of the stomach; renal impression, which is related to anterior surface of the left kidney, and colic impression, which is related to left colic flexure. Between the intermediate border and the gastric impression, there is another impression here, pancreatic impression. The pancreatic impression is related to tail of pancreas. The diaphragmatic surface is related to the diaphragm, and the diaphragm separates the spleen from costodiaphragmatic recess and 9th, 10th and 11th ribs. Peritoneal relations. The spleen is completely enclosed by peritoneum. The peritoneal folds or ligaments of the spleen are: number 1, gastrosplenic ligament. The gastrosplenic ligament extends from hilum of the spleen to the fundus of the stomach, and it contains the short gastric arteries. Number 2, lienorenal ligament. It extends from the hilum of the spleen to the anterior surface of the left kidney, and it contains the tail of pancreas, splenic vessels, that is splenic artery and splenic vein, and pancreatico-splenic lymph nodes. Blood supply. The spleen is supplied by the splenic artery, which divides into 5 or more branches before it enters the hilum of spleen. The splenic artery is tortuous, and it is a branch of celiac trunk. Venous drainage. The splenic vein drains the venous blood from the spleen. It joins the superior mesenteric vein to form the portal vein, which drains into the liver. Some of the tributaries of splenic vein are inferior mesenteric vein and gastric veins. Based upon the pattern of terminal branches of the splenic artery, the spleen is divided into 2 types: diffuse type of spleen and compact type of spleen. In diffuse type of spleen, the terminal branches of the splenic artery are long and they arise far away from the hilum of spleen. In compact type of spleen, the terminal branches are short or small and they lie very close to the hilum of spleen. Segments of the spleen. The spleen is supplied by splenic artery. The splenic artery divides into superior and inferior branch after entering the hilum of spleen. The superior branch and the inferior branch supplies the superior segment and inferior segment of the spleen, thus making an avascular plane between the 2 segments. The avascular plane lies perpendicular to the long axis of the spleen. The knowledge of vascular segment of the spleen is essential for segmental resection of the spleen to preserve the splenic tissue if required. Nerve supply. The sympathetic fibers arising from the celiac plexus supplies the spleen. Clinical anatomy. Splenomegaly. Enlargement of the spleen is known as splenomegaly. The spleen may enlarge as much as 10 folds. The most common cause for splenomegaly are cirrhosis of liver, malaria, chronic myeloid leukemia. Splenectomy. The surgical removal of the spleen is known as splenectomy. During splenectomy, if there are accessory spleen present, it should be removed. Care should be taken not to cut the tail of pancreas, which is rich in islets of Langerhans during splenectomy, else it results in diabetes mellitus.